Introduction to Babysitting First Aid. Babysitting involves significant responsibility, particularly regarding a child's safety and health. Understanding basic first aid is not merely beneficial, it is a critical skill that can make a profound difference in an emergency. This course equips caregivers with the knowledge to respond effectively and confidently to various situations, ranging from minor scrapes to more serious medical incidents. Preparedness reduces panic and allows for swift, appropriate action, which is paramount when caring for children. Ultimately, this training enhances the safety of the children and provides peace of mind for both the babysitter and the parents. The primary goal of first aid is to preserve life, prevent worsening of the condition, and promote recovery. For babysitters, this translates into being able to assess a situation quickly, provide immediate care, and know when and how to seek professional medical help. This foundational knowledge is crucial for creating a secure environment and ensuring that any health challenges are met with informed and capable responses. It empowers babysitters to act as responsible and reliable guardians during their time with children. Emergency preparedness and calling 911 before any babysitting assignment. It is imperative to gather critical emergency information. This includes the parents' contact numbers, their location, and the contact details for a trusted neighbor or emergency contact. Knowing the child's medical history, allergies, and any regular medications is also vital. Furthermore, identify the nearest hospital and understand the fastest route to it. This proactive approach ensures that in an emergency, valuable time is not lost searching for information, allowing for immediate and effective action. In a genuine emergency, dialing 911 or your local emergency number is the first and most crucial step. When speaking to the dispatcher, remain calm and clearly state your exact location, including the street address and any distinguishing landmarks. Briefly describe the nature of the emergency, the child's condition, and any first aid measures already administered. Do not hang up until the dispatcher instructs you to, as they may provide vital instructions or ask further questions. Following these steps ensures that professional help arrives as quickly as possible. Assessing the scene and child. Upon encountering a potential emergency, the first priority is always to ensure the safety of the scene. Before approaching the child, quickly scan the surroundings for any immediate dangers such as broken glass, electrical hazards, or falling objects. If the scene is unsafe, do not enter. Instead, call for help from a safe distance. Once the scene is deemed safe, you can then focus on the child. This initial assessment protects both the caregiver and the child from further harm, establishing a secure environment for providing aid. After ensuring scene safety, approach the child and assess their responsiveness and condition. Gently tap the child's shoulder and speak loudly to them, asking if they are okay. For an infant, flick the sole of their foot. Observe their breathing, skin color, and any visible injuries. Look for signs of distress, such as unusual sounds, difficulty breathing, or unresponsiveness. This rapid assessment helps determine the severity of the situation and guides the subsequent first aid actions, ensuring appropriate and timely intervention. Basic life support. Choking. Infants. Infants can choke easily on small objects or food, making it a critical emergency for babysitters. Recognize choking by observing if the infant cannot cry, cough, or breathe, or if their skin turns blue. A silent, ineffective cough or high-pitched sounds are also red flags. Immediate action is vital to clear the airway and restore breathing. Panic can hinder effective response, so maintaining composure is essential. Understanding the signs of choking allows for prompt intervention, potentially saving a life. To perform first aid for a choking infant, position the infant face down along your forearm, supporting their head and neck. Deliver 5 firm back blows between their shoulder blades using the heel of your hand. Then, turn the infant face up on your other forearm, supporting their head, and deliver 5 rapid chest thrusts using 2 fingers on the breastbone, just below the nipple line. Repeat this sequence until the object is dislodged or the infant becomes unresponsive. If unresponsive, begin CPR immediately. Basic life support. Choking children. Choking in children, typically aged 1 year and older, often occurs during mealtimes or play with small objects. Signs of choking in a child include inability to speak, cough or breathe, clutching their throat, or turning blue. Unlike infants, children may be able to indicate they are choking. It is crucial to differentiate between a mild obstruction, where the child can still cough effectively, and a severe obstruction, which requires immediate intervention. Encouraging a child with a mild obstruction to cough can help clear the airway naturally. For a conscious choking child, perform abdominal thrusts, also known as the Heimlich maneuver. Stand behind the child, wrap your arms around their waist, and make a fist with one hand. Place the thumb side of your fist just above the navel and below the rib cage. Grasp your fist with your other hand and deliver 5 quick upward thrusts into the abdomen. Repeat this sequence until the object is expelled or the child becomes unresponsive. If the child becomes unresponsive, immediately initiate CPR. CPR for infants, cardiopulmonary resuscitation. CPR for infants is a critical skill for any babysitter, used when an infant is unresponsive and not breathing normally. It is a sequence of chest compressions and rescue breaths designed to maintain blood flow and oxygen to the brain and other vital organs. Knowing when and how to perform infant CPR can be life-saving. The decision to initiate CPR should be made quickly after assessing unresponsiveness and absence of normal breathing. Early CPR significantly increases the chances of survival. To perform infant CPR, first ensure 911 has been called. Place the infant on a firm, flat surface. Use 2 fingers to deliver 30 chest compressions on the breastbone, just below the nipple line, at a depth of about 1.5 inches. Follow with 2 gentle rescue breaths, ensuring the infant's head is tilted slightly back and the chin lifted. Cover both the infant's mouth and nose with your mouth. Continue cycles of 30 compressions and 2 breaths until emergency medical services arrive or the infant shows signs of life. CPR for children. CPR for children, typically aged 1 year to puberty, differs slightly from infant CPR in terms of technique and force. It is necessary when a child is unresponsive and not breathing normally. Understanding these differences is crucial for effective resuscitation. The goal remains the same: to circulate oxygenated blood to the brain and other vital organs until advanced medical help arrives. Prompt initiation of CPR can significantly improve outcomes for a child in cardiac arrest. To perform child CPR, ensure 911 has been called. Place the child on a firm, flat surface. Use 1 or 2 hands to deliver 30 chest compressions on the center of the chest, at a depth of about 2 inches. Ensure the compressions are firm and fast. Follow with 2 rescue breaths, tilting the head back slightly and lifting the chin to open the airway. Cover the child's mouth with your mouth, pinching their nose closed. Continue cycles of 30 compressions and 2 breaths until emergency services take over or the child revives. Wounds, cuts and scrapes. Cuts and scrapes are among the most common injuries children sustain while playing. While often minor, they require proper cleaning and care to prevent infection. Recognizing the difference between a superficial scrape and a deeper cut is important for determining the appropriate first aid. Even small wounds can become infected if not treated correctly, leading to more serious health issues. Prompt and thorough care ensures quick healing and minimizes complications. For minor cuts and scrapes, first wash your hands thoroughly with soap and water. Then, gently clean the wound with mild soap and water to remove any dirt or debris. Avoid harsh antiseptics like alcohol or hydrogen peroxide, as they can damage tissue. Apply a thin layer of antibiotic ointment to the cleaned wound. Finally, cover the wound with a sterile bandage to keep it clean and protected. Change the bandage daily or if it becomes wet or dirty. And monitor for signs of infection, such as redness, swelling, or pus. Wounds, bleeding control. Significant bleeding from a wound can be alarming and requires immediate, effective intervention. The primary goal is to stop the blood loss to prevent shock and further injury. It is crucial to remain calm and act quickly. Assessing the severity of the bleeding helps determine the urgency and type of intervention needed. Rapid and appropriate bleeding control can prevent serious complications and stabilize the child until professional medical help arrives. Your actions in the first few minutes are critical. To control bleeding, apply direct pressure directly onto the wound using a clean cloth, sterile gauze, or even your bare hand if nothing else is available. Maintain continuous pressure for several minutes without peeking to see if the bleeding has stopped. If blood soaks through the material, do not remove it. Simply add more material on top and continue pressure. Elevate the injured limb above the heart if possible. If bleeding is severe or does not stop after 10 to 15 minutes of direct pressure, seek immediate medical attention by calling 911. Burns, tights, and treatment. Burns are common household injuries that can range from minor to severe, depending on the depth and size of the affected area. Recognizing the different types of burns, first degree, second degree, and third degree, is crucial for appropriate first aid. First degree burns affect only the outer layer of skin, causing redness and pain. Second degree burns involve deeper layers, resulting in blisters and more intense pain. Third degree burns are the most severe, damaging all layers of skin and potentially underlying tissue, often appearing white or charred. Correct identification guides treatment. For first and second degree burns, if blisters are smaller than 2 inches, immediately cool the burn with cool, running water for at least 10 to 20 minutes. Do not use ice, as it can cause further tissue damage. Gently remove any clothing or jewelry near the burn, unless it is stuck to the skin. Cover the burn loosely with a sterile, non-stick bandage to protect it from infection. Do not break blisters. For third degree burns, or any burn larger than the child's palm, call 911 immediately. Do not apply any ointments or home remedies to severe burns. Fractures and sprains. Children are prone to falls and accidents that can result in fractures, broken bones, or sprains, stretched or torn ligaments. Differentiating between these injuries can be challenging without medical imaging, but recognizing the signs and symptoms is crucial for appropriate first aid. A fracture might present with severe pain, swelling, deformity, inability to move the limb, or a grinding sensation. Sprains typically involve pain, swelling, bruising, and limited movement but without deformity. Any suspected fracture or severe sprain requires professional medical attention. For a suspected fracture or sprain, the immediate first aid involves the RICE protocol. Rest the injured limb to prevent further damage. Apply ice packs wrapped in a cloth to reduce swelling and pain for 15 to 20 minutes at a time. Use compression with a gentle bandage to support the area and minimize swelling. Elevate the injured limb above the heart level to reduce swelling. Do not attempt to straighten a deformed limb or put weight on a suspected fracture. Call 911 for severe injuries or transport the child to an emergency room. Head injuries in children can range from minor bumps to serious concussions or internal bleeding. Even a seemingly minor fall can lead to complications, especially in infants and toddlers. It is crucial to monitor a child closely after any head trauma. Signs of a serious head injury include loss of consciousness, persistent vomiting, severe headache, confusion, slurred speech, or unequal pupil size. Any of these symptoms warrant immediate medical attention. Early recognition of warning signs is critical for preventing long-term damage. For a minor head bump, apply a cold compress to the injured area to reduce swelling. Observe the child closely for at least 24 to 48 hours for any developing symptoms. Keep the child awake for a short period after the injury to monitor their alertness. Avoid giving pain relievers like ibuprofen or aspirin without medical advice, as they can mask symptoms or increase bleeding risk. For any signs of a severe head injury, call 911 immediately. Do not move the child if a neck or spinal injury is suspected, unless they are in immediate danger. Allergic reactions and anaphylaxis. Allergic reactions can range from mild skin rashes to severe, life-threatening anaphylaxis. Babysitters must be aware of any known allergies a child has, including food, insect stings, or medications. Symptoms of a mild allergic reaction include hives, itching, or a runny nose. Anaphylaxis is a severe reaction characterized by difficulty breathing, swelling of the face or throat, dizziness, or a sudden drop in blood pressure. Recognizing these signs quickly is paramount, as anaphylaxis requires immediate medical intervention. Always review allergy information with parents beforehand. For severe allergic reaction, anaphylaxis, immediately administer an epinephrine auto-injector, EpiPen, if one is available and you are trained to use it. Follow the instructions on the device. Remove the safety cap. Press the tip firmly against the outer thigh for several seconds and hold it in place. After administering the EpiPen, call 911 immediately, even if the child's symptoms improve. Monitor the child closely for any recurrence of symptoms. For mild reactions, antihistamines may be appropriate, but always consult with parents or medical professionals. Asthma attacks. Asthma is a chronic respiratory condition common in children, characterized by episodes of difficulty breathing, wheezing, coughing, and chest tightness. An asthma attack can be triggered by various factors, including allergens, exercise, or cold air. Babysitters must be aware if a child has asthma and know where their inhaler and spacer are located. Recognizing the signs of an impending or active asthma attack is crucial for timely intervention. Early treatment can prevent the attack from escalating into a severe respiratory emergency. During an asthma attack, help the child sit upright in a comfortable position. If they have a prescribed inhaler and spacer, assist them in using it according to their doctor's instructions, typically 2 puffs every 4 to 6 hours as needed. Encourage slow, deep breaths if the child's breathing does not improve after a few minutes, or if their condition worsens, call 911 immediately. Continue to reassure the child and keep them calm while waiting for emergency services. Never administer medication not prescribed to the child. Poisoning. Children, especially toddlers, are naturally curious and may ingest household products, medications, or plants that are poisonous. Recognizing the signs of poisoning is critical, as symptoms can vary widely depending on the substance. These may include vomiting, drowsiness, abdominal pain, difficulty breathing, or unusual behavior. Always keep poisonous substances locked away and out of reach. If you suspect a child has ingested something harmful, immediate action is necessary. Prevention is the best defense against poisoning incidents. If you suspect poisoning, immediately call Poison Control, 1-800-222-122 in the US, or 911. Be prepared to provide information about the child's age, weight, the substance ingested, the amount, and when it happened. Do not induce vomiting unless specifically instructed by poison control or emergency medical personnel. Keep the container of the ingested substance handy for reference. Follow all instructions given by the professionals. If the child becomes unresponsive or stops breathing, begin CPR and call 911. Fevers and seizures. Fevers are a common symptom of illness in children, indicating the body is fighting an infection. While most fevers are not dangerous, high fevers can be concerning, especially in infants. A seizure is a sudden, uncontrolled electrical disturbance in the brain, which can cause changes in behavior, movements, feelings, and levels of consciousness. Some children may experience febrile seizures triggered by high fevers. Recognizing the signs of both fever and seizure is important for appropriate management and knowing when to seek medical help. Always consult parents about their child's typical fever response. For a fever, monitor the child's temperature and provide comfort measures such as light clothing, a lukewarm sponge bath, and plenty of fluids. Administer fever-reducing medication like acetaminophen or ibuprofen only as directed by parents or a doctor. For a seizure, ensure the child's safety by moving any nearby objects that could cause injury. Loosen tight clothing around the neck. Turn the child onto their side to prevent choking on vomit. Do not restrain the child or put anything in their mouth. Time the seizure. Call 911 if the seizure lasts longer than 5 minutes, if it's their first seizure, or if they do not regain consciousness after the seizure. Heat-related illnesses. Children are particularly susceptible to heat-related illnesses, such as heat exhaustion and heat stroke, especially during hot weather or strenuous activity. Their bodies do not regulate temperature as efficiently as adults. Heat exhaustion symptoms include heavy sweating, weakness, dizziness, nausea, and cool, clammy skin. Heat stroke is a more severe, life-threatening condition characterized by a high body temperature, over 104 degrees Fahrenheit, hot, red, dry or moist skin, confusion, and loss of consciousness. Recognizing these differences is crucial for appropriate intervention. Preventing these conditions is always preferable to treating them. For heat exhaustion, move the child to a cooler environment, loosen tight clothing, and apply cool, wet cloths to their skin. Offer sips of water if they are conscious and not nauseated. Monitor them closely. If symptoms do not improve within an hour, or if they worsen, seek medical attention. For suspected heat stroke, call 911 immediately. While waiting for help, move the child to the coolest possible area and begin cooling them rapidly with cool, wet cloths or a cool bath, shower if available. Do not give fluids to an unconscious child. Cold-related illnesses. Children are also vulnerable to cold-related illnesses, such as hypothermia and frostbite, when exposed to cold temperatures for prolonged periods. Hypothermia occurs when the body loses heat faster than it can produce it, leading to a dangerously low body temperature. Symptoms include shivering, confusion, drowsiness, and cold, pale skin. Frostbite is an injury caused by freezing of the skin and underlying tissues, typically affecting extremities like fingers, toes, nose, and ears. Recognizing these conditions early is vital for preventing serious tissue damage and systemic complications. Proper layering of clothing is an important preventative measure. For mild hypothermia, move the child to a warm, dry place. Remove any wet clothing and replace it with dry, warm layers. Offer warm, sweet drinks, not hot. Wrap them in blankets. For frostbite, gently warm the affected area with warm, not hot, water. Around 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Do not rub the affected area, as this can cause further damage. Do not use direct, dry heat. Seek immediate medical attention for both severe hypothermia e.g., unconsciousness, no shivering, and any suspected frostbite. Call 911 for severe cases. Common childhood illnesses. Babysitters will frequently encounter children with common illnesses like colds, flu, stomach bugs, or ear infections. While these are usually not emergencies, knowing when to worry and how to provide comfort is essential. Symptoms often include runny nose, cough, sore throat, mild fever, or stomach upset. It is important to communicate any new or worsening symptoms to the parents promptly. Understanding the typical course of these illnesses helps in managing expectations and providing appropriate care. Always prioritize the child's comfort and well-being. For common illnesses, focus on comfort measures. Ensure the child gets plenty of rest. Offer clear fluids frequently to prevent dehydration. Provide soft, easily digestible foods if they have an appetite. Manage fever with appropriate medication as directed by parents. Keep the child isolated from other children if contagious. Watch for any red flag symptoms such as difficulty breathing, severe pain, persistent vomiting or diarrhea, or extreme lethargy. These signs indicate a need for immediate medical attention. When in doubt, always contact the parents for guidance. Cuts and scrapes. Advanced care. While basic cleaning and bandaging are sufficient for most minor cuts and scrapes, some situations may require a more advanced approach. Deeper cuts, wounds with jagged edges, or those that continue to bleed after direct pressure may need professional medical evaluation. It is important to recognize when a wound might require stitches to heal properly and prevent infection or significant scarring. Observing the wound's characteristics and the child's overall condition helps in making this determination. Prompt medical attention for more severe wounds is crucial. For deeper cuts, continue applying direct pressure. If the wound is gaping or very deep, it may require stitches. Do not attempt to clean a very deep or profusely bleeding wound extensively. Focus on controlling the bleeding and seeking immediate medical help. If an object is embedded in the wound, do not remove it. Stabilize it with bulky dressings and seek emergency care. Always monitor for signs of infection, even after professional treatment, which include increasing redness, swelling, warmth, pus, or fever. Communicate all details to parents and medical personnel.